It's drive up.
Can anybody hear anything? Is he speaking?
Oh, sorry. I just realized I was on mute. Okay, so I'm gonna give you guys some tips to navigate the ATI. Um, you want to first log in, and what I do is I usually have two screens open at the same time, side by side, and you'll see why I do that. But first, we want to know how to organize our notes, and ATI usually has handy templates for that. So when you log in, go to My ATI right here and you want to hit your active templates. So over here, this is how this is pretty much like the organization you want to do for your notes. So like when it comes to like farm, you're going to use the medication. You guys are in fundamentals and med surge. So I would use for those classes, I would use system disorders for med surge and nursing skill for fundamentals. So we'll just start with this one.
Wait, I'm sorry to interrupt, but when I go online, I don't see that.
Why don't you see it?
Is there like a specific school code I'm supposed to put in?
Why you don't see these templates? That's your question?
Yeah.
So you see when you log into ATI and you hit My ATI, there's the study
Oh,
material, and you can. This is what you're usually seeing. But if you click over here, there's an active learning template.
oh wait, I'm sorry. One more question. Do I have to log in with my school ID or my regular ATM that I use to take my T's exam? That's what I'm use for.
Are you a first semester student?
Yeah. Well, yeah, just basically I'm new to school, but I'm taking fundamentals.
So it's whatever you logged in with your T's. You just have to purchase the package. There's a package that they're gonna send you a link for. You have to
Is
purchase
that the
that.
$600 that I paid? Is that the package?
It's the 600 you said?
Yeah, the $600 that I paid when I
Yeah.
enrolled. Is that the package?
Yeah, that's it. So it should populate. You should get all these little like modules. Okay. Okay, so want to go into this active template. We'll start with the nursing skill one. So you just click it, open it. It's going to open as a PDF. And then how this PDF is, this is how you want to pretty much organize your skills. I mean your notes. So let's say the skill is I don't know, like colonoscopy care, colonostomy care. This is what you would do. Let's say it's enemas or vital signs, whatever. You just fill in all these little boxes. If you download it and open it, you can actually type directly into this. So watch. So you can actually type directly into it to just like make it easier for yourself. So I find these helpful in like organizing your notes. So like you see right here. Okay. So after you get these templates for your note taking, you have to know where to get the information from. So your professor is going to teach you guys stuff in class, um, but you have to do a little bit more reading and pulling the information from somewhere else, which is going to come from the ATI information. So let's say we want to learn fundamentals, right?
Yes.
You want to go into your review module right here, and you're going to open up your fundamentals review module. So let's just do that really quick. This is pretty much those books you got in sometime in the beginning of the semester. They give you like a bunch of books. These are just the books, but they're the ebooks. I prefer the ebooks, and I'll show you why. Just give me a second.
Hi, I'm trying to follow along with you, but I'm for LPN for PN. So I'm in the review module for 2023 PN, and what book do I need to open? Is it one for fundamental?
Yeah, same
Oh.
one. Fundamentals. If you're in the fundamentals, let's do the fundamentals book. So this is the fundamentals book. Just bear with me. Yeah. Okay, and then just bear with me. Just give me a second. Just want to carry this over here.
Okay, you send it from.
Sorry, just give me a second. It's a little bit slow. Okay, so we'll keep this over here. Okay, so like I said, you want to open up the fundamentals module, so we can start with whatever topic. So I think you guys are starting with, let's see, pain management, right? Or is it mobility you guys are starting with? Let's do actually
Infection control, mobility.
infection control, mobility. Okay, so let's go to mobility then. So when you have the book open, there's like certain units. You see how it's saying unit 1, 2, 3, whatever. You have to pretty much filter through this till you find what you need. So I know it's in here. So we're doing hygiene, right? So this is where you're going to get most of the information from. Everything in here is where you're going to get your test questions from. And if you notice, like when you do, let's say we're doing hygiene, right? The reason why I prefer the ebook is because when you do it, you'll read a little bit of the section. So you read it, and then as you read, there's questions on what you read. So this helps you get familiar with the ATI questions, which is very important. So that's one section to get information from. I would focus heavy on the book. The book is pretty much everything you really need to know. But there's another section in the ATI modules where it puts more emphasis on the information. And if you read that as well as the book, then you should do very well in your classes. So that's the Engage Fundamentals modules. So if we open this up, and like I said, you have to filter through till you find what you need. So this would probably be foundational concepts. So let's see if we can find what we're doing. Hygiene, right? Vitals, where is it? Client education, informatics, mobility. Maybe it's in here. Sometimes you have to just keep looking till you find the exact section. Physiological concepts.
I'm sorry, how did you get to the engage? Where is that located at?
The engage. Okay.
Mm-hmm.
I think, do you think that's the secret? I mean, because I feel like there's such an age with you. This is our first time meeting. I'm meeting you with the Tan family here in the audience.
So the engage, like your review module is right here. This is where the book is, right? It says ebook right here.
I see that. Mm-hmm.
You keep scrolling through, you're gonna see the engage. And they're gonna have an engage for each one of your courses. So they have engage for med surg, mental health, maternity, peds, gerontology, they don't have it, but they have it for all those other ones. So someone has to mute their mic, leading into our recording.
And I know that. And, yeah, or something bad. Everybody has a day. Everybody has bad. What's your advice to people who are, if you know, writing my own script, making sure that I live the life I want to live versus what everyone else tells me. Because you're going to look up.
Madeline, I think you need to mute your mic. I think.
Like, I wish I tried. Why didn't I write that?
Make notes by yourself.
What was it?
The purpose is to read the books and make notes by yourself.
Yeah. Okay. All right, perfect. Now
I'm sorry, I don't see the engage because I went through the modules I went through everything from I'm in the learn tab right now and I see the modules for the ebook. Oh wait, let me see. For learn tab. Engage.
within the learn tab, yeah.
Okay.
Do you see it? You should see a bunch of things.
Oh yeah, I see engage fundamental PN. Okay. 40 miles. Thank you.
All right. Perfect. So we want to go into our modules and we're doing hygiene, right? So you want to pull up the hygiene module, which sometimes like it can be a little annoying. You have to just filter through till you find whatever concept you're learning in your course. So whatever is in like your unit 1 exam, that could be like 7 topics. You want to go through all of these and see everything within it and make sure you cover those topics.
On the top, you can't search. On the top where it says sort, is that not searchable? Is it not searchable if you
Yeah,
go
there's no search feature there.
up here where it says sort and then all?
Up here, it's not really a search feature. It's more just a filter. But if you go through it, there's only this one fundamentals has 40, but the other ones only have like 20, so you can look through it really quick. But you see how we have hygiene right here? So there's 2 things in here you're going to need to do. There's the lesson. So after you read the ebook on hygiene, you can go into this. The ebook alone should be enough. It has a lot of information, but if you do these lessons, it gives you even more information, and it just gets you more familiar with the terminology that they use in nursing. There's a lot of like synonyms for words that they interchange, and that's what you're going to see in your test. The words interchange. So like you could learn it one way, but then they could use 5 or 6 or 7 different words to say the same thing. So it's always good to read through this, but if we open it, I'll give you an example. So let's open that and we'll go into hygiene. So they start with bathing, right? This gives you pretty much everything you need to know about bathing, right? And then if you go into this, it's going to pretty much repeat those concepts. Whatever repeats, you want to go into the lesson, right? So this lesson gives you a little pathophysiology right here. And then it's going to keep going down. It's going to be a little more information. But that's why I like this one right here. This pretty much explains the patho. So if you're not familiar with the pathophysiology or the anatomy parts of the body, this will give you the explanation to them. So like you see, it's giving you this different layers of the skin. So it'll help you get familiar. It explains the mucous membranes, the teeth, gives you the different layers. The nails, it explains it. So it's all good information. And then they give you little tests like questions. You want to do these questions. It's going to get you more familiar with ATI questions during your test. They're pretty much like the same format. So if you do all of these, it's going to better well prepare you for your exams. Okay. And then these are the lessons. The skills part, these will pretty much give you like scenarios for like if you're doing like, let's say we're doing foot hygiene, right? Foot care. It's going to give you the scenario and it gives you step-by-steps of what you do during foot care. So like you see step 1, step 2, step 3. So it's one thing to learn the information, learn the importance. So like this is like all the information, right? You see how it's only giving you like this much? It's not really giving you the step-by-steps, which is kind of what you need to know. This gives you the breakdown of the step-by-steps. So you learn the information and then this gives you like the exact things you would do if it's like a simulation. So this stuff's kind of good to just run through, just reinforce the information for yourself, okay? And then there's just like couple of little hints here and there, like these rationales. These are like little hints of what the importance of everything is. Okay. And then after you do all of that reading, so like let's say you did all the reading on the hygiene, right? I would focus heavy on the book, and then after you do all the reading, you want to go into your hygiene exam. So they'll give you test questions within that module. And it's crucial you do those test questions before your exam. And it'll just help you better prepare for the exam. And then just give me a second. Let me just open it up really quick. Let's see, where are we? Give me a second. I just gotta find it really quick. Where were we? Oh, it's in here. Oh, right here. So you see hygiene, you want to do these exams.
I'm sorry, which tab was that in?
This was in the last tab. I think it was physiological.
Oh, okay, great, thank you.
Yeah, the physiological tab. But you want to make sure you do these exams before your exam. Sometimes they're pretty much like the same questions. There's only so many ways you can ask questions, but they're pretty much like the same thing that they're gonna ask. It's the same format. But if you see like this is where you get your examples for like how you can practice for your SATAs, your NGNs, all of these. So like if you look at this, the nurse is reviewing a list of client care tasks with another nurse. In which of the following scenarios should the nurse plan to use soap and water? So when do you use soap and water? Visibly soiled. Do you use soap and water if they have infectious diarrhea? You should, yeah. Because C. diff, the nurse moves the cell phone of a client who has pneumonia. You don't necessarily need soap and water for this. This. And I think that should be it. But this is how you pretty much practice, and then it'll give you the rationales. So more SATAs. And that's, you want to get as many questions done as possible. So it prepares you with the ATI language. The more prepared you are with test taking skills, the better you'll do in your exams. I'll show you guys another place to get questions from. So that was one place. You get it from the ebook, you get it from the modules. There'll be questions, small questions here and there, and you get it from those exams. That's another area you can get questions. And then the last area you want to get questions is in your nursing skills tab. Okay, just give it 1 second. Okay, so if you scroll through, there's a tab right here. You see skills modules. So these are like your simulation modules for certain skills. So like vital signs, oxygen management, hygiene will be in there. So airway, blood administration, bowel elimination, your IVs, your chest tubes. So this is where you can get more information. This is important in like med surg and fundamentals. But let's see if we can find the hygiene one. I'm pretty sure they have one. So like hygiene would kind of be, oh, right here, personal hygiene. So you can do the lessons in here, or you can do the test. The lessons, this goes extremely into depth on it. I wouldn't recommend doing it unless you want to really learn the information really heavy. So like there's only certain places I would do lessons. It's when the book doesn't give you enough information. So like chest tubes, it doesn't go too much information into it. So that I would do the lesson for chest tube, but hygiene, not necessarily. But if you do the test here, they'll give you 8 questions. It's just more information for you to practice for your ATI language and test taking skills.
I have a
Better
question.
prepare you for your
I'm going for
exams.
LPN, but I'm also in a class with people that are going for RN. Shouldn't RN and LPN be different fundamentals or no?
I
Okay.
believe you guys are
Wouldn't the
the same
questions go more in
fundamentals.
depth for
Yeah.
RN than it should for LPN?
A little bit, but it's almost the same thing.
Okay.
It's really not that much different information you guys are learning. I think like it more differentiates when you get to like med-surg.
Okay. Thank you.
But like fundamentals, there's not much difference in LPN and RN fundamentals. But if you see right here, more questions. You want to practice as many questions as possible.
Okay.
I think the ATI test is different for RN and LPN a little bit.
Slightly, but I think your fundamentals exam will be the same. Everything except for the exit exam.
Yeah, we were told that the first 2 semesters are kind of identical. Once you pass the first 2 semesters is when it starts changing for LPN and RN.
Mm-hmm. Exactly.
Thank you, guys.
No problem. If you go into your assessment, I'll show you some more areas you can get questions from. So you want to do as many questions as possible, just to get used to the language, and then that's just going to help you do better on the exams pretty much. But we're going to go into our assessments tab now.
Hey, how are you? Okay.
So within your assessments tabs, you're going to
I
get
have a question before you go further.
Uh-huh.
Can you close the nursing skill tab so we can see the one you're working on better, please?
Yeah, sure.
Thank you.
There you go. Okay. Okay. Let me zoom in. All right, that's better.
Yes, yes, yes. Thank you so much.
Okay, so you see this right here, the dynamic quizzes. You want to open this up. And then click right here. Click your quizzes. And this gives you like an entire test bank. It has like maybe like 1,000 or 2,000 questions within it. It pretty much is like all the information. Just you can filter it out. So I'll show you guys how to filter it. So when you go to browse questions, right here, like if we click fundamentals, it's just going to give us the questions that are related to fundamentals. Just give me a second. There we go. Okay, so fundamentals, right? We're going to browse through. And I think fundamentals has like 470 questions. Okay, 409. So you can click over here. And pretty much what you should do is you could go through all these questions, but just do the questions that are related to your exam coming up. So like if you just keep following through till you find like a hygiene question or an infection question or whatever is in your Unit 1 exam and so on, you could practice on those questions. And there's about 409. You can also search through it. So if we click this, let's say it's gonna kind of be hard doing like searching just hygiene. But I would recommend doing this, like, let's say we're doing chest tubes, right? You could search up just chest tube. And it'll give you a bunch of questions related to chest tubes. So like if it's enema questions, etc. And then you could filter it through subject, I believe. So we have chest tube. We're gonna just click fundamentals. And then, okay, so it gives us one question right here. Something related to chest tube. But I recommend going through all of these. You should do all of these before your ATI exit exam, along with the modules. So that's the ATI you guys take at the end of the semester. You should do like unit 1, do 20%, 40% for 2, 60% for 3, 80% for 4, and then be almost finished with the rest of them by unit 5 or the final. And that just helps you better prepare for that exit exam. So you guys can like score like 80s or 90s. Okay, and then lastly, it's always good to do these assessment. There's test A and B's. So we're doing fundamentals. You see how there's a test A and B? I like to do these throughout the entire semester. And I just go through the questions that are related to whatever topics. So like if you're unit 1, you have like 8 topics, just do those 8 topics. Just do those questions that are related to that. So just skip the ones you don't know, and just keep going. If you're in MedSurg though, you have to do these throughout the entire semester. So MedSurg comes with, I believe there's like 8 or 9 or 10 different ones. So you see immune system, there's the final, there's the practice assessment. So there's respiratory, there's practice questions here, practice questions, neuromuscular, there's a fall quiz here, fall quiz, midterm. I would do all of these throughout the entire semester, just to help you prepare. It's very helpful doing these because sometimes they repeat the questions within it, or they'll just reword it a little bit. But that's going to get you good success in MedSurg. Make sure you do these. They sometimes filter them by the topic. You see how like it's neuromuscular. One was immune system. You see cardiovascular, endocrine, GI, perioperative, renal. So like sometimes they label it on the specific topic. Make sure you do these.
Is that works? Clear.
Mental health is almost the same thing.
Ooh, yeah, that's okay.
Let me show you. Let's see. Let's see. Mental health has test A and B. I think it's gerontology that has a lot of them. Gero. So like you see gerontology, you see how it has all these assessments. Whoever's in gerontology, make sure you do all of these. Like do it before exam A, to be honest. Because they sometimes repeat these questions. They'll reword it a little bit, but just do all of these. They're not that bad. And you guys pretty much know all the information for gerontology already, because you learned it in MedSurg. It's like almost the same information. So it's worth doing all these and reading the ration.
Have a good day. Thank you.
And I think that's pretty much it. Let me see if there's anything else. Okay, I think that's pretty much it. Does anyone have any questions?
Yeah, now on, I have a question. I heard about a Claire on ATI. Are you familiar with it?
A what?
Claire, CLAIR.
Oh, Claire AI?
Yes, Eclair AI. Are you familiar with that?
Okay, so there's two formats to clear. There's the student's format and there's the professor's format. The professor's format creates questions. Um, so like they'll make ATI questions. I don't believe we have access to that. But for us, you can use Clear AI like this. So like let's say um, we're in this. Give me 1 second. I believe it's right here. Where is it? It pops up on the right side. Um, maybe it's in the modules. Let's see. I think for our Clear AI that we can use, you can just ask it like a couple of questions and the
That's what the
information you need to
professor
know.
suggests that we use instead, and that we should purchase it. So that's why.
I don't think it's something you can purchase
Okay.
though. I mean, I've never seen that as a product unless that's something new, but I can find out for you right now.
All right. Thank you, Norma.
See, for educators, so you see, I think this is just for educators.
Oh,
This is what like you can use to create questions. I I've seen it for us, like students, but it pops up on the side. Unless they don't have that feature anymore, or maybe I disabled it, but it pops up on this side and you can ask it questions. Like you have a question about hygiene.
mm-hmm.
Um,
Okay.
let me see. Maybe there's a student section.
I heard it was a product. That's why I was
Yeah,
like,
you
where do I
see,
find it?
see right here. This is the product.
I see Clear for educators. Yeah.
Um,
Okay. So then there should be one for students, but it's not though.
let's see, ATI nursing education, meeting the challenges, engage students, student mentor with Claire now available, engage, choosing student mentor with Claire.
I'll find out more this week when I actually meet my professor. Someone was just telling me about it.
Mm-hmm. Okay.
I'll find out more this week, yeah, because they were just telling me that we gotta use that. So I was just inquiring. Thank you.
No problem. No problem. Second. Let me see if there is. Yeah, Professor Modest, I discussed the ebook. Sorry, I just saw your chat. Does anyone have any other questions? I told you guys pretty much there's many places to practice the information and receive the information. You receive the information from the ebook and the modules. And then if you need first, you can go into the skill to learn oxygen management, do your more questions, practice the ATI language, and get better in test taking skills. Oh, and there's one more thing I forgot. There's one more thing I want to show you guys. There's actually a section in ATI. What? There's a section in ATI that actually teaches you how ATI formats their questions. So like, you know how there's some questions that are like negatively worded, the select all that apply questions, the NGN, the bow ties. There's a section within ATI that teaches you how to do those questions. They give you the tips. So if you go to Nurse Logic 2.0 or whatever it's called, open this up. And then let's take a look. So all of these show you how to pretty much take your exams. So like these are like the priority setting questions, clinical judgment questions, nursing concepts, but you can go into these. I would first focus on testing and remediation. This I've seen this give yeah.
Okay, asking questions. I'm gonna show you.
Mhm. It's ATI is usually like around like 600 a semester. There's four payments you have to do. So
Is it pay by semester?
pay by semester, yep. Otherwise, it's like around like 3,000 or something, but they split into four payments for everyone. So you see over here, oh, you guys can still hear me, right?
Yes.
Okay, perfect. So you see over here, it's gonna pretty much give you like little tips and tricks. And these are like videos. So this is like test taking skills. I want to focus on specifically how their test taking strategies. Okay, right here. So their test taking strategies, they're gonna teach you how they ask the questions. So like negatively worded questions, positively worded multiple choice, negatively worded multiple choice, interpreted codes, eliminating incorrect options. You want to do these videos, and it's going to teach you exactly what to look out for and how to find the right answer. So if we take a look at this, right? So like they're going to give us, this is like an ATI question, right? I'm going to skip it. They're going to teach you what positively worded words are and negatively worded words and priority setting. So if you look at the video, it shows you exactly how to cross out the options in the multiple choice, what you want to look for, and then how you can come up with the best answer. So these are actual test taking skills, and it's specifically oriented towards how ATI asks their question. So I find these. I did this when I first started AMG, and the concepts they teach you here is pretty much how you can answer all their questions. So like this is a priority setting question, right? So this is like, which one's the priority, right? So these videos are just nice, quick tricks to pretty much get your test taking skills better. It's definitely going to help you score higher on your exams. So I definitely recommend just looking at them. It probably takes a total of 30 minutes to do them. And you only have to do like the test taking. So you don't have to like do how do I take notes? Like you can skip those questions or those videos. You don't really need these. But as far as the test taking section, do those. And I think that's pretty much it. That's all the tricks I can think of. Anyone have any questions?
How did you get there then?
Hopefully this week.
Yeah.
We just have to. We'll post it as soon as
Okay.
possible.
Perfect. Thank you.
It's in the.
They ask you exactly questions and what's, eliminating a negative answer or whatever. Like, I think this is really for those who have ATI first semester and not really familiar with that. That's a really good start to just really get you a good base and understanding.
Right. Then if everyone's good, I'm gonna complete this session. Okay, guys? And if you guys have any other questions, feel free to stop by the student coordinator office. It's 207.
217?
Oh, 217.
Absolutely. Thank you so much.
Then if they can't explain something, they'll pass over your message to me and I can always contact you and help you with this stuff. Okay? Thank you.
Thank you so much for joining, everybody.
All right.
I saw 22 people. That's amazing.
All right, guys. You guys take care, all right?
Thank you, guys. Hi, Miss Janet Clark. I see you. I see everybody here. I see you. I see your family names. Very much. Very good. Thank you.